My name is Kathy Bennett, and I am a PhD candidate in the health science field at Trident University. I am delighted to present on this forum today on what I believe to be a crucial and essential topic, a gap analysis of existing mixed methods research literature examining African American women veterans of urban communities impacted by military sexual trauma post-transition is an intentional research approach to addressing this crucial topic to identify racial inequities, social determinants of health, creating barriers and challenges to sustainability post-military service. Significant problems within this population result from military service linked to barriers and challenges to quality of life factors impacting their ability to have sustainable lives. I am passionate about this topic mainly because I am among this demographic. My goal is to rescue other victims of the systemic challenges that cause thousands of women who experience military sexual trauma to be impacted adversely post transition. The lessons learned from lived experiences must be included in the research for identifying the problems and the solution. It's a matter of humanity. I thank Trident for offering this field and allowing this complex and controversial topic to be explored in our academic history. The dissertation topic, a gap analysis of existing mixed methods research literature examining African American women veterans of urban communities impacted by military sexual trauma post transition. More importantly, I want to thank the administrators, the academic staff, the professors, and all the supporters within Trident whom I've come to know and who has helped me achieve this scholarly challenge for conceptualizing my theory on women veterans. Our conceptual model is represented here by four pillars, of which we will further dissect in our next slide. The golden thread problem statement, our research design methodology data analysis, our literature review, and our implications, recommendations for further study, which are abbreviated for the purpose of this presentation. Our concepts and the relationships among the constructs variables are presented clearly and logically, which is the goal of a gap analysis of existing mixed methods research literature examining African American women veterans of urban communities impacted by military sexual trauma post transition using this IPO conceptual framework model. The concepts, constructs, and variables input variables that cause problems, the demographics, the process, method by which the variables are measured, and the output, which describes the phenomenon of the outcome, where intervention services and support will be measured in our logic model as part of our intervention strategy. The golden thread applied will suggest identifying the aim, research question, and objective of the research. This study aims to conduct a conceptual framework model of research major themes and patterns of recent studies, a gap analysis of existing mixed methods research literature examining African American women veterans of urban communities impacted by military sexual trauma post transition. The proposed research primary objective is to conduct a mixed method meta-analytical thematic study examining characteristics of women veterans experiencing post-transitioning challenges in urban communities who have experienced military sexual trauma, resulting in barriers and challenges to intervention that result in social determinants of health, racial inequities, and poor quality of life comparing others within this demographic. The aim is to establish a pilot program that assesses intervention needs and links to necessary services and support. Our primary research question is, does age, ethnicity, gender, and sex impact military sexual trauma victims that result in post-transition barriers and challenges to a suitable quality of life as they relate to terms in service from age to 80, from the presently enlisted minimum age of 18 to the Vietnam era that are presumed greater than or equal to 75 years of age? Our statistically hypothesis is based on this research, two research questions. Is there a statistically significant impact on African American Black citizens who are victims of MST and transition to urban communities after military service? And what barriers were experienced by veterans for intervention in post-transitioning support and services in urban communities? Our problem statement: women veterans from urban areas affected by military sexual trauma from a marginalized group needing specialized support, notably impacting African American women transitioning in urban settings. This population faces substantial challenges post-transition, hindering their quality of life and ability to maintain sustainable livelihoods, and urgent attention to these issues is merited. A literature review focused primarily and abbreviated for this purpose of this presentation. Cover my foundational study, Dr. Washington and her team that screened um, several 100,000 veterans and determined that women are the fastest growing veteran population. MST affects women and men more women in a recent study of 30,738 and screened for military sexual trauma. 26% screened positive for MST. And another source, Web, reports that MST is prevalent and severe in 26% of the sample size of 735,645 active duty service people. Monteith, another source, found that women are more affected by military sexual trauma compared to men. Additionally, urban African or Black women experience disproportionately marginalization, resulting in the worst outcomes due to social determinants of health. This is according to Monteith and Washington, which again is our foundational study. According to Valine, from a 2021 research study and Washington 2023 study, urban women veterans affected by social determinants of health reported need for more intervention for service support. They experience bias, health disparities, and racial inequities more than other ethnicities and races. Our method and design is a mixed method research design based on a thematic, meta-analytical, and convergent parallel triangulation analysis. Quantitative and qualitative data are studied simultaneously but analyzed separately for this sequential exploratory study. A concurrent convergent parallel triangulation design because data is selected because data is collected over the same time frame, concurrent and merged using convergence design. Then it is equally weighed in this parallel assessment and multiple methods are employed to examine the same issues. We have an advanced design to assess intervention to program services and support as the overarching goal and to establish a pilot program as an impetus to solving these problems. All efforts have been put into minimizing biases in this study. The result is that a module was formulated impact and adaptation that would help these communities make more effective choices in their sustainable efforts in the future. We are adding this advanced design using the logic model evaluation tool to formulate a qualitative program evaluation to answer questions needed to move forward for usefulness, funding, policy, and legislative support. Data analyzed of Black women veterans urban screening for MST, 735, 645 active duty service members across the military with 70% of respondents. The survey of healthcare experiences of patients using a certain screening tool, SATP, patient-centered home survey instrument, and the fiscal year 2016-2019, an external peer review program, quality monitoring program for Black or African American individuals was comprised 13.3% of the American population in 2016. It is currently estimated that by 2060, the Black or African American population will grow to 15% of the total United States population. And a hospital study specific to conditions that are potentially in this population of 582,000 that was studied for heart attacks found that 13.3% of women and 12.6% of men treated by male doctors and died from their heart attacks, although overall survival rates improved when a female doctor provided a treatment, a narrow gap. This has to do with gender-specific health care, which we will discuss more particularly in the dissertation itself. However, I wanted to note that in this presentation to draw attention to the severity of the gender roles in the research. A triangulation of mixed methodology studies is combined to establish common themes and patterns for this thematic analysis. Disparities research studies address the common themes associated with age, sex, gender, and race relative to racial inequities and health disparities, and the quantitative research identifies sexual assault with a pattern identified assessing support services within the population. A sample of 887,752 of the 9 million enrolled patients, 83.6% are urban, of which 13.3% are Black women veterans, and of the those enrolled who screened for sexual assault, 26% of that number, which is 130,000, screened positive for MST. The meta-analysis data, a logical regression analysis to examine associations of a positive MST screening with various mental and physical health conditions defined by administrative diagnosis codes and comorbidity of mental and physical health conditions. Models were adjusted for the healthcare facilities' demographic and military service characteristics and duration. MST was also associated with greater comorbidity, including greater odds of having greater than or equal to 2 mental health conditions, odds ratio of 3.28, 99% confidence interval, having a greater than or equal to 2 physical health conditions, and mental health at odds ratio of 1.226%, where 99% confidence interval and overall physical health conditions, there was an odds ratio of 2.05, 99% confidence interval. A confidence interval is the mean of your estimate plus and minus the variation in the estimate. This is the range of values you expect your estimate to fall between if you redo your test within a certain confidence level. Confidence in statistics is another way to describe probability. For example, if you construct a confidence interval according to Scribble.com, the odds ratio measures the strength of the association between an event and exposure, with larger ratios indicating higher odds of the event occurring with exposure, calculated by dividing exposed groups by unexposed, and divide the odds of the event in the exposed group by the odds of the event in the non-exposed group to obtain the odds ratio. Findings suggest that MST is common in women veterans and may play a role in the clinical complexity arising from comorbid conditions. Huang pointed to a 2018 study, and she authored that tracked nearly 582,000 heart attack cases treated in Florida emergency room from 1991 to 2010, and it found that 13.3% of women and 12.6% of men treated by male doctors died from their heart attacks, although overall survival rates improved when a female doctor provided treatment. A narrow gap remained. 12% of the women died and 11.8% of the men died. And I would argue that that could also have other variations that could be studied with regards to the other demographics, whether they were of a different ethnicity, race, age, male sex, or any of the variables in our study. I just wanted to make note of that for the purpose of this study, which we dive a little bit more into in the dissertation itself. A triangulation of mixed methodology studies is combined to establish common themes and patterns for this meta-analytical thematic analysis from an inductive postmodernist paradigm. This presentation provides an abbreviated aspect of the overall research study that addresses a thematic meta-analytical mixed methodological data retrieved from secondary data sources, a concurrent parallel convergent triangulation for summarizing the study. The quantitative data resulting from the logistic regression calculation shows a confidential interval, of which we did um, explain that a little bit in the previous slide. Based on the data, the hypothesis will show that African American women veterans have a statistically significant impact on their lives compared to other ethnicities, races. The barriers reflect the variables showing that health disparities and racial inequities are barriers to intervention. As a researcher, the action theory deductive postmodernist epistemology applies to the thematic meta-analytical analysis. These are charts from the overall foundational study where the overall women veterans population is characterized in Section 2 and Section 5 of this study as urban, with 83.6% of those enrolled for care compared to 56.6% white, and among this group, 14.8% are African or Black women veterans in urban communities compared to 6.5% white women veterans enrolled in the VA system compared to 2019, according to this study. The implications for practice on the field of study. The literature review reveals gaps for an inclusive data analysis. The gap analysis implies significant cultural, systemic research, and scientific fraud, and gender and racial biases are evident in the existing research. Significant implications of health disparities and racial inequities to access to intervention for women veterans, and especially Black women, are unique in the description of women veterans. There is evidence that significant work and research must be valid and reliable for establishing integrity in the outcomes. Future research recommendations would suggest: number one, a comprehensive research strategy demonstrating knowledge of military and veteran dichotomies and distinctions in cultural, language, and specific terminologies. A comprehensive strategy that defines veterans across government with definitions of significant terms, for example, gender, sex, military branches, and the characteristics uniquely applicable to each service. A comprehensive and knowledgeable research strategy driven by competent, qualified policy and advanced expert learning in relevant agencies and references as an authorized official influence and global standard. This does conclude my presentation, and I thank you so much for your attention and for your listening. I hope that there has been areas of interest in my presentation on the topic of African American women veterans who have been sexually assaulted, and that this conceptual framework will help to guide some thinking towards other scientific explorations on the military community.